Hey guys, welcome to the biochemistry clinical case discussion. Okay, so I hope you guys have had some exposure to yesterday's video, right? Yesterday we had one biochemistry clinical case discussion that was on the same topic, that is under the heading of mucopolysaccharidosis, that is under the heading of mucopolysaccharidosis, right? So it is the accumulation of mucopolysaccharides, also called as glycose aminoglycans, right? So there were of various types. So yesterday we had discussed mucopolysaccharidosis type 1, okay, and that was called as Hurler disease. That was called as Hurler disease, right? So today I'd ask you that we will be doing mucopolysaccharidosis type 2, that is Hunter disease. Okay, so before watching this video you must watch the video on Hurler disease. You will find it in the YouTube playlist, right? It's just streamed yesterday, so today is 5th May. You'll find it on the date of 4th May, right? It streamed yesterday night. Okay, ठीक है. So welcome to Let's Crack NEET PG. My name is Chetanya Mittal. I am currently pursuing my MBBS from AIMS New Delhi. I hope you guys have downloaded the Unacademy learning application. In case you haven't done that, you can go and register on the app, and you can use my invite code Chetanya10 to unlock free plan, right? As your educator, I invite you to Unacademy and access all the free content there. Okay, so before I tell you more about Unacademy, today what I'm going to tell you is, first I'll discuss the class, and then I'll tell you about the Unacademy subscription plan at the end. Okay. Hi PG aspirant, I saw your comment on my previous video. Let's see if you also comment on this video. Okay, right? So who is this that you can see in this picture? Who can you see in this picture? You can see obviously that this is a hunter, right? But this hunter is very out of shape. This hunter is very out of shape, right? Appears that he has a swollen face, right? Otherwise, what are some characteristics that should be there in the hunter? That should be there in the hunter, right? First thing that you can appreciate is that the hunter is a male. That the hunter is a male, right? First thing. Okay. Generally, not to be biased in any way, but this is just for the sake of memorization, you will mostly see hunters are males, right? Okay, there's a bias in that profession towards the male gender. Okay, so whenever you think of a hunter, a male will come to your mind, right? Second thing, hunters, they are able to, right, they have to shoot some deer or something going at a distance, right? So they need very good eyesight. They need very good eyesight. Okay, so there is something I will tell you, but just keep in mind that a hunter should be male and he should have good vision or good eyesight, right? Am I correct? Those should be the features that a hunter shows, right? So we are beginning with the biochemistry clinical case discussion with that knowledge in mind about Hunter disease, and I hope you guys know a little bit already about Hurler disease, that was mucopolysaccharidosis type 1H, right? And we are talking about Hunter disease, which is mucopolysaccharidosis type 2. Remember, it is a lysosomal storage disease. It is a lysosomal storage disease that occurs due to the defect in certain enzymes which are responsible for the breakdown of mucopolysaccharides or glycosaminoglycans. Because of that, those mucopolysaccharides or glycosaminoglycans, they are going to accumulate in the lysosomes, and that is going to cause a problem for that person. Okay, so Hunter disease. Okay. So one of the symptoms, if you guys remember the important symptoms of Hurler disease, you should be able to apply them here as well. So the first thing that I want to emphasize that is different from Hurler disease is the inheritance pattern. It is the inheritance pattern. If you guys remember, I told you that Hurler disease, it is due to a gene called as IDA. It is due to a gene called as IDA, which is present on the long arm of the fourth chromosome. Sorry, short arm of the fourth chromosome. So it is going to follow which inheritance pattern? It is going to follow a autosomal recessive inheritance pattern. Autosomal recessive inheritance pattern. Whereas if you have a look at this particular pedigree, you will notice, okay, so this mother is infected, this mother is infected, this father is Normal. Father is normal. Okay. Now both the sons are affected. Okay. So I'll just write down what can be the possible way in this is getting transmitted for your understanding. Right. His mother is affected. So she will have to have both X chromosomes as affected. Now in the child, the Y chromosome is coming from the father, and they will have X chromosomes that are infected because mother can only give an infected X chromosome, right? Similarly, you can see here that this mother was a carrier. Why? Because one X chromosome, both them they were carriers because they got one X chromosome from here, and this X chromosome was normal. So that's why the son of this mother is affected. Similarly, here you can see, since this mother is affected, all the children are going to be affected. Okay, so this is a pedigree for X-linked recessive disorder. This is a pedigree for X-linked recessive disorder. So first thing that you should be able to do is you should be able to identify the pedigree, because sometimes what can happen in the exam, they might not directly mention that it is an X-linked recessive condition. They might just ask which of the following depicts the pedigree of Hunter disease, right? And you will have to identify X-linked recessive. Or they might say that pedigree is shown, identify the mucopolysaccharidosis. Now why is that possible? Because Hunter disease is the only mucopolysaccharidosis which is X-linked recessive. Okay? So this becomes a very important point, that it is X-linked recessive, whereas Hurler disease and all other mucopolysaccharidosis, they are autosomal recessive. They are autosomal recessive. Now second thing that comes to us, is going to be regarding this feature. So I told you, if you remember, that a hunter requires very good vision. Okay. So now just correlated with that fact that Hurler disease, there was a symptom that was called as corneal clouding. Corneal clouding. Clouding means that something becomes foggy, dhundla ho jata hai, right? Cornea is your eye, so your eyesight, it becomes blurred. Whereas in Hunter disease, there is no evidence of corneal clouding. Corneal clouding will be absent. So that is again another discriminating feature, and discriminating features are very important because they help you to identify a particular disorder. So Hurler disease, you will also not have corneal clouding. So now you can correlate both facts, that how is MPS2, that is Hunter disease, different from Hurler disease, right? So how you remember it is that a hunter is strong. So milder clinical course as compared to Hurler disease. Hurler disease is very severe. Hunter disease, it's not as severe. Hunters are mostly males, so it mostly affects males. X-linked recessive, they affect males more than females. Third thing, hunters require a good eyesight, so there will be no corneal clouding. There is not going to be any corneal clouding. So that's the difference. Now identify the defect. Okay. So there, if you remember the defect, well and good. Here the defect is in L-iduronate sulfatase, right? Okay. Again, this is related to iduronic acid, and if you remember from yesterday's lecture, iduronic acid, it is a component of heparin sulfate and dermatan sulfate. That is why more or less it is very similar. The only difference that is coming is regarding a few features like corneal clouding and the inheritance pattern. The gene is IDS, and you can remember very easily iduronate sulfatase, right? So nothing different. IDS gene, right? Now, what about the treatment options? Yesterday I told you the treatment options for Hurler disease. So there we had an enzyme called as aldurazyme, and I had told you that stem cell therapy was also available for Hurler disease, But for Hunter disease, okay. So PRN is saying that I should stop. Okay. Any doubts that you have? PRN. हाँ जी PRN बताओ. If you have any doubts, please tell me. PRN. Okay. Chalo. Meanwhile, I'll continue. You type your doubts, please. Okay. So the enzyme here, it's not aldurazyme. Instead, we are using an enzyme called as elaprase. And the use of stem cell therapy is very questionable. It's very questionable in case of Hunter disease. Okay. So we have found out quite a few points of difference. Let's quickly summarize the differences between Hurler disease and Hunter disease. Okay, quickly let's summarize. This was mucopolysaccharidosis type 1H. This is mucopolysaccharidosis type 2. Okay, what was the enzyme defect in Hurler disease? Anybody remembers the enzyme defect in Hurler disease? In Hurler disease, it is caused by a mutation in alpha L iduronidase. The gene defect is alpha L iduronidase. Sorry, the enzyme defect. What is the gene defect? Gene defect is IDA. Gene is IDA gene. Okay, here what is the name of the gene? The gene is IDS gene, and S stands for sulfatase. So the enzyme defect is L-iduronate sulfatase. Right? That's the defect. Now what else do you know about the genes? So this gene is present on chromosome 4p, right? So it is autosomal recessive disorder. And this one, sorry, I'll write it with a different color. Yes, so this is the IDA gene and this is the IDS gene. This is present on the short arm of the fourth chromosome. This is present on the X chromosome. So this disorder is autosomal recessive, whereas this disorder is X-linked recessive. Okay, and last clinical differentiation that we have done, clinical differentiation that is again very important, is the fact that here you are going to have evidence of corneal clouding, whereas here you do not have corneal clouding. That's the last feature. So these are the 5 points of differences between Hurler disease and Hunter disease, both of which are mucopolysaccharidosis that are a class of lysosomal storage diseases. That they are a class of lysosomal storage diseases. Understood? Understood the underlying disease condition, underlying biochemical defect, and the underlying differences with Hurler disease. So in case you hadn't watched, okay, one more last point that you can maybe add here. Okay, I'll help you guys add it. We'll have to condense this a little. Okay, that's related to the treatment, so it's not very relevant when you are studying it from a biochemistry point of view, but maybe when you study it later on, right, it will be more relevant to you. But never mind, we'll still write it as a point of difference anyways. So, okay. Now from the treatment point of view, we are using aldurazyme here, and here we are using which enzyme? If you remember the name of the enzyme, we are using elaprase. Right? One more difference, last difference, okay. I know you guys are probably tired now. Okay, let's write it with green only. Stem cell therapy is available for this, whereas for this disease, stem cell therapy it is not available, or it is not used very frequently. Its use is not having significant improvement. Okay, so I'll just get away. Maybe you guys can understand better. Right. So if you guys have taken a screenshot, I guess you should be able to remember now. And yeah, so that brings us to an end on this lecture. If you haven't watched the lecture on Hurler disease, please do watch it. There I've also explained the basics of mucopolysaccharides and everything related to mucopolysaccharides, right? So this is a very short video where I've explained to you everything about the Hunter disease and what are the differences that are there with the Hurler disease, right? So now I'll tell you a little bit about the Unacademy subscription. We have some of the top educators teaching live on Unacademy, right? And these educators, they are making plus courses for you, which are obviously paid courses, and you need to get a subscription to access them, right? At the same time, sorry, we have free of cost special classes that are available for NEET PG, right? So you can enroll on the uh, application for these special classes, okay? And these are going to give you a live classroom experience, that is of batch courses. You will get access to special tests, weekly tests, and all of that, right? So you can have enough testing, and you can also clear your doubts. Okay. So Unacademy is a one-stop solution for your NEET PG preparation. Okay, PG aspirant, I'm glad you were able to understand. Okay, Smriti, thank you so much for listening. Thank you, Beam Ready. I'll try to take a class on protein metabolism. Actually, right now I got a lot of suggestions for this topic, that was CVS physiology. So I have planned an entire free of cost lecture series on CVS physiology. Okay, it will take around 7 to 8 lectures, but I want to do it from A to Z. Okay, so you can watch it and brush up your knowledge of CVS physiology. Okay, it will be starting soon, and we have batches that are starting from today for NEET PG, INI, CET, Next, and FMG. So you guys still have time. You guys can go and enroll for these batches. All you need is a subscription. We have over 34,000 questions for you guys to practice. Okay, and you can see what are the upcoming batches, what is the advantages of Unacademy. So just download the Unacademy app, explore the app for yourself using my invite code Chetanya10. Okay, please use that invite code. And we have a plus subscription, we have a iconic subscription. So the difference is that in the plus subscription you are getting everything on Unacademy. In iconic you are also getting the benefits of prep ladder. So as you might be aware that we have recently acquired for $50 million prep ladder, India's largest online learning platform. Unacademy has acquired prep ladder. So we are giving you the premium video lectures, we are giving you the question bank 3.0 is coming very soon, rapid revision course, and the handwritten notes at a discounted price here, right, along with Unacademy. So if you go for the iconic subscription, we have a very beautiful limited time offer going on. You will see that the subscription otherwise costs 92,000 rupees, but if you apply my referral code, you will see that the discount comes to be 58,500. You will get it for 60,000 rupees. Okay, the subscription for 2 years it is 50,000 rupees, and for 1 year you will get it for 40,000 rupees, and for 1.5 years it's 45,000. So it's very reasonable, very proportionate. You can take it. And for Unacademy Plus, we have a 3+1 offer going on. So you watch it for 3 months, you will get 1 month extra, right? And these are the various plans for Unacademy Plus: 1 month, 3 month, 1 year, 2 year, 3 year. You can go for any of these plans, and you can see how to apply the referral code. You have to purchase it on an Android phone, right? iOS does not show discount, it shows extra weeks, right? Purchase it on an Android, and or you can purchase it through the website and apply the referral code, apply the credits, and take advantage. Okay. Shubham is asking the timing of the CVS. So you guys tell me what is the timing suitable to you, right? So we'll keep the class at a fixed time only then. You guys tell me what is the timing you guys are comfortable with, what timing should I keep, and I will keep accordingly only timing for CVS lecture. If you want, I will share the entire schedule with you. Okay, I'll plan completely how it is going to go so that you guys can clear your schedule accordingly. So you tell me what should be the timing for the classes for CVS physiology, and we will do it accordingly. You can drop the timing in the chat box. I'll have a look. And thank you so much guys for watching. You guys can remember to hit the like button on this video. Subscribe to our channel, Let's Crack NEET PG. Okay. And you can drop a comment once the video stops streaming. Right. And also subscribe to the Telegram channel, that is t.me/Let's Crack NEET PG. From there you can also find the link of my Telegram channel and you can join it. Remember to hit the bell icon for notifications. I'll also be sharing the notes for this video. And this is my referral code Chetanya10. You guys can subscribe using this referral code. Okay? Okay, I'll try to keep the timings in the evening. I'll try to keep it sometime in the evening. Done. Okay, so mostly I'll keep it around 7 p.m., 8 p.m., 9 p.m., sometime around that. Okay, so that you guys can easily attend. You guys don't have any online classes. Okay? Okay, great. Take care. Remember to hit the like button for this video. Thank you so much. Bye-bye. You can also put your doubts on the Telegram session. Yes, so I will end on this slide. So you guys can take advantage of this offer. Okay, because today the batches are starting. So today is the best time to enroll. You'll get the maximum benefit. And one more advantage of Unacademy over other applications is that Unacademy you can also access on your laptop. So anyways, you are spending so much time on your eyesight, right, while learning. So it's best if you can learn on a laptop. Others, they will have a restriction that you cannot stream on your TV or your smart TVs, right? Or you cannot watch in any other way. So on Academy, you will not have any restrictions. And with Prep Ladder, you can access the premium content. So it's the best partnership for you guys to watch, and definitely try to take it if you guys can afford it. And if you can convince your parents, that'd be good. Okay. Thank you so much. Take care. Bye bye. And we're also having I will also be having CVS Physiology MCQs on the Unacademy platform. So also follow me on my Unacademy page.